Hey everybody, it's Dr. Seiler from Seiler Skin. So we're going to shoot a cool video today on Candace. Candace is one of our team. She's been working with us for a little while now. We've not done anything on her. I've not done any injections on her yet. She's had some Botox and filler in the past. And she's learned a lot from me about some of the unique ways that I use Botox and my whole philosophy called Gravity Fix. And you know, a lot of injectors know to inject the upper facial areas with Botox or another neurotoxin for movement. But a lot of injectors, unfortunately, don't know to inject the lower face. So we're going to do kind of a normal, conservative amount in her forehead, between her eyes and around her eyes, the typical 3 areas. Raise up just a little bit for me. And she doesn't move too bad. Her last Botox was what, you said, in May?
May.
And so most of that's worn off now, but she's got some movement back. Squint between your eyes for me, and then smile and squint in the camera. And so, you know, the typical dose is, more than I put in most patients. So I'm really conservative with it. I think she'll see a good result. We'll see her, she works here, obviously. So we'll look at her in a couple weeks, see if we need to do any more. Here's what's unique, I think, about our practice is that we really focus in using Botox in the lower face. So purse your lips for me. She's got good lip volume, but you can see she really fires this upper lip muscle, what we call the orbicularis muscle, and that causes her to make little vertical lines. But when she smiles, smile really big for me, you can see that she loses some of the show of her lip. She's got some volume in her lip from some previous injections she had, but Botox is going to help to keep her from moving so much that she makes the vertical lines in her upper lip, but also get her to show. So it's what we call the Botox lip flip. And in a lot of patients, Botox alone is good enough to give you a little augmentation and show of your upper lip without even having to put filler in, although a lot of patients will still want filler after. Big area in her that we really talk about lately is we haven't seen a whole lot of her movement because of mask wearing with COVID and everything, but when we do see her move, you can see that she really fires what we call the DAO muscle. See if you can really frown for me. And she fires her chin. Okay, relax. And she does, she's young, but she doesn't like the fact that she's got a little bit of a downturn to the corner of her mouth, more than she would think that she should have at her age. And it's all because of movement. It's not because of volume loss. So in my opinion, it would be under-treating the patient to just use a little bit of filler around the mouth without releasing that muscle. And again, fire again for me. You can see she really fires that muscle and fires her chin. So what she's done is she's so expressionate with her mouth, like a lot of people are, that she's done that for so long now that muscle just is pulled down on the skin, that the skin's tired of trying to go back up, and it just stays kind of downturned. So you'd be amazed at what just a little bit of Botox on each corner here and a little bit in the chin. We typically use about 5 to 10 units of Botox in each area. It's not a lot of Botox. After a couple of sessions, it will really release the muscle, and then the corners of her mouth I expect to turn up really nice. And I honestly don't think she's going to need any filler around her mouth. She's got good volume. If you look at the rest of her face, which we analyze with our Gravity Fix idea of looking at the 5 proportions of the face, she's got great cheeks, she's got a really good jawline, she's got good chin length. If you're watching this for training purposes, it's also always important to look at the side view of her so you can see the length of her nose, her lips, and her chin. So all of that I evaluate when we figure out what we have to do. And then, she really doesn't fire her neck. A lot of patients need Botox in the neck. She fires this just a little bit, relax for me, but it's not really pulling down on her jawline here. So in her, we're not going to treat her neck. You can't really see or feel this, but she does have a decently strong masseter muscle, so we're going to do a little bit of Botox in her jawline here. And again, it doesn't take a lot of Botox, usually 5 to 10 units on each side. Will help to relax that muscle. And in a female, especially if they're in good shape, if they exercise, they tend to kind of grind their teeth for whatever reason. With time, not only will this become painful and a functional issue, but it will also tend to kind of flare the jawline, and it will masculinize the face a little bit. So we can reduce that and keep her nice and slim, keep the triangle of her face going in this direction. So here in just a second, you're going to see us do our Botox injections everywhere, and we'll give her a good result. All right, so thanks for watching my long intro. We shoot these videos for both patients and for trainees, so I'm trying to get good information in there. We're going to do a little conservative Botox. We've already prepped her skin. I do a little wiggle here just to keep her from hurting. And again, like I said, this is the first time we've done Botox in her, so I'm excited to see if she thinks that I don't really hurt her much. We'll see. And this is a good example of, if you do have just a little spot of bleeding, you really want to make sure you hold pressure. That's all the difference between having a little bruise and not. Most of the time patients don't bleed at all, but if they have a tiny little spot, you really want to make sure you hold pressure. I'm going to let Cindy take that one over for just a second. And I'll move to the other side. And Candace has got really, really good skin, good features to her face. She really doesn't move too much, but she'll benefit from a conservative Botox treatment. And this will just help to keep her from pinching that muscle that kind of makes the little crow's feet. Pressure there for a second. Also see that I always pass the needles behind the patient so that they don't, even though she's got her eyes closed, that way they don't see it. Might keep her finger on that just one more second. Now I'm going to do our little glabellar shots. This will keep her from frowning between her eyes. And don't worry, we're getting to the good stuff here in just a minute. We're going to do the lower facial injections here in just a sec after I do the upper. Just figured you guys would want to watch all of them. I'll get that last one over there when I get to that side. I'm going to pull that one up just a little bit more. And we're going to do her forehead now. You see she's not really bleeding between her eyes there, so we're okay. Lift up your eyebrows real hard for me. And she raises her eyebrow pretty good. She said that she kind of lifts this side a little bit harder than the other. So we're going to go a little bit lower and a little bit more outside with this shot. Injection there, and then I'm going to move to the other side. Not hurting too bad, is it? Lift up the hard. You can see she doesn't pull up as hard that side, so what I'm going to do is I'm going to stay a little higher with the injection on this side, and hopefully we'll even up her brow. But we always take a look at anybody that is new to getting Botox, or anytime we need to, at about 2 weeks once we know it's all kicked in, and just make sure everything's good and even. Yeah, I'll take that extra one. I'm going to do her last little glabellar shot, and then I'm going to show you all the areas are cool. We're going to show you kind of the areas that are a little bit more rare to treat and a little bit more unique. So we're going to do her jaw next. This is the Masseter muscle, and it's not bad in her. I mean, you can feel it. So what I do is I have them clench their teeth and hold it. All right. Relax, and I kind of put my 2 fingers on where the mound is, and that's where I do my 2 injections. And we really don't start with a lot of Botox. Sometimes the true TMJ dose can be anywhere from 20 to 50 units per side, and insurance really struggles to cover it now, so most people aren't able to put that much in, and I usually put about 5 to 10 units on each side. So we're going to switch to the other side. We'll finish off the jaw, and then we'll do our lip next. You can see that even though she's just got a little spot there, that little spot that bled on her eye over there, because we held pressure for a minute, it stopped and it shouldn't bruise at all. All right, relax. And what's interesting here is in this area, most people are asymmetric, so she's a little more in this angle right here where her masseter mound is, and so you'll see that I do my injections at a little bit different placement here than I did on the other side. So if you're an injector, you've really got to pay attention to make sure you get it in the bulk of the muscle. Here's one other quick teaching point. The rhizoris muscle, which is what we call the 5th elevator of the mouth, is a muscle that comes straight across here. And if you get too close to that, you can drop that muscle and cause them to not be able to smile as big. I've actually had that happen one time to me. No big deal, it goes away, but you want to avoid that. So if you're watching this for training purposes, you always want to start as posterior on the masseter as you can so that you don't hit that muscle right there. It's a sneaky muscle that you forget about that will sneak up and get you if you go too forward on your injections. All right, so let's ice just for a little bit in her lip. She's not had me do her lip before, so I'm interested to see if she thinks that, oh yeah, okay, so we're getting ice. So we're going to do our DAO next. All right, frown for me just a little bit. Okay, relax. So you want to stay really lateral on this shot. The bulk of the muscle is a little farther out than you think it is. She may need a little bit more in a touch-up, but we'll fix that if we need to. And then wrinkle your chin for me. You can see she really fires that muscle. Okay, relax. Here's another cool thing about doing the chin. So we do put filler in the chin sometimes to give a little bit of chin length, but lots of times the muscle is so tight in patients that it's holding back the skin of the very front of the chin and the jaw. And if you can release that with Botox, they get a nice little length to their chin, and it makes their overall proportions of their face. Again, this is all in the idea of the gravity fix philosophy that I've developed to understand the proportions of the face Let's ice this side real quick. That might be the fastest I've ever seen you go get ice. We have fun when we do our injections, especially if it's on my team. Okay, good. And then the trick to doing this injection is you want to stay really low on the vermilion border and really medial, almost right on the filter column. I do this little kind of wiggle so they don't feel too bad. How's that? Not bad?
I feel it.
Very good. Everybody's always afraid of this injection because it's going just above the lip, but it's really not bad at all. Patients are always surprised it doesn't hurt. What you want to do though is you want to stay from going too lateral too high so you don't drop their lip. This will just release the circular muscle and kind of help give them a little bit of a flip. And then so the camera can see, I'm going to do it on this side a little like that. If you're treating a gummy smile, where when the patient smiles they really show their gums, then you can put a little bit more Botox in and you go a little bit higher and a little bit more outside. Cool little tricks if you really understand what you're doing with the muscle. You can see she's not bleeding at all from that. She had just a tiny little bit of bleeding up here, but she should be fine, and that little side right there shouldn't bruise. We always tell patients if they think they have a little bruise just to keep a little ice on it. We can always do IPL the next day. All right, frown again for me. You can really see that muscle. All right. I don't know that I've seen a DAO muscle fire harder than that. So this is just going to make a huge difference for her. Joking with her, and I wouldn't say this to a patient, but she works for me, so I can joke with her a little bit. I'm so excited to see what this does after a couple of treatments because it really pulls down on the corners of her mouth. And again, you would miss that if you didn't know to do Botox. A lot of people would, unfortunately, just put some filler right there in the corners of her mouth and it wouldn't fix it because she's got good volume. She really doesn't need any filler there at all. And Botox is honestly a lot cheaper than filler, so just adding a little bit of Botox in these lower areas to the upper three areas doesn't add a lot of cost and is really treating the cause and not just the symptom. Hold a little pressure on that just for a second and we will be all done. So once again, this is using my philosophy called Gravity Fix. The fix is PHIX, so it's the 10 areas of the face using the 5 proportions, which is all the geometric proportions and angles and ratios of where everything basically should be. So if you really understand those things, you know where to put product, where they need tightening, and it also can help a patient know whether they're a good candidate for filler and tightening procedures or whether they're really more surgical. Usually in a patient, if you can lift their cheek with a finger or two, you're going to be in my category of injections and laser treatments. And if you have to use a lot more pull than that to get them happy, then they're probably more surgical. So thanks for watching. If you're a patient, check out our website at SeilerSkin.com. If you're someone interested in training, we've got great online courses at Seiler Skin Aesthetic Institute. It's SeilerSkinAI.com, and we hope you enjoyed the video.